A lot of people talking about all that good stuff. I've heard a lot of people loving the data placemats, and I know a lot of the conversations I haven't been a part of have been about how are the outcomes changing or not changing, and that becomes really important to what we're doing. So that's what I'm seeing. You let me know as a group if accountable as part of the outcomes doesn't feel like enough. And I'm done. I'm going to hand it to Anderson.
Thank you. I agree in terms of the important piece is really about outcomes. And I guess I want to get a little meta here in the sense
We
of
do have the same brain.
what's like, and this might be a different direction.
Oh, okay.
But like listening to the conversation of what's happening here, and that's why I was thinking about our shift of like the pronouns from like the talking about them to talking about us, because the what's happening here where we're representing a system, we've invited families and we've invited youth to come share their perspectives. Well, as systems folks, we're seeing our youth and our families are not in agreement. How then as a system do we hear that and try then to do our mission as we're talking about what that looks like? I think at the end of the day, as folks in the system, we know that we're doing the work. So then if we can then focus on that more aspect of like, how then do we support our families and our youth? And what does that look like, especially when they're not always in agreement, knowing the history of these conversations so that we can focus on the outcomes. It's more so what I wanted to bring back into the conversation in a meta way of like what's actually happening here in this conversation.
Yeah, I love that reflection and table setting. Brian, thoughts?
Thinking about Anderson. I'll just first say, Brian, that when I wasn't here yesterday, one of my staff colleagues was here, so I apologize I didn't make the first day, but it's exciting to be here the second day. And I sort of want to affirm you all and that you're having some hard conversation around words, but bigger than just the words, the kind of concepts and the values and the meaning. So we do this too at our council and in our small agency. So I don't have answers for you, but I
Dang it.
appreciate that. Yeah. Yeah. Sorry, Anna. But we have similar conversations and in our for Youth Development Oregon, we do have the word equitable in our mission statement for whatever that's worth. So know that it's there, have had conversations about should that stay or not, have a strategy around equity and transparency, and have had questions and conversation about, wait, should we keep that? Should we not? Do receive some federal funds. They pass through DHS. So, but we've stood firm for whatever that means, like we're still there. And guess what? We don't always get it right. Or my staff, but we run a competitive request for application process, which is to say people apply for grants. The way that process operates is not equitable. It's competitive. You get scored and the highest score wins. We are not saying, and it's in statute. So while we have a value around equity, there's some things we do which aren't achieving equitable outcomes. Now I've given you that like as a high top level thing. There are ways that we ask questions and we do some things. We look at our data to see, hey, guess what? We are serving a majority of kids of color through our grants and other communities and populations that are furthest from opportunity. So we're getting to outcomes, but a competitive process by its nature is not equitable. So I'm saying you're not always going to get it right. Still like push, pull. So just take that for what it's worth. The last thing I'll say is, and somebody this is sort of a question and a statement. We have tribal nations in our mission statement. You have in your vision something about Oregon. I think your dollars support tribes, yes? Tribes or sovereign nations, you don't, so I'm hopefully speaking to the choir. So if you're going to say Oregon, you probably should say sovereign tribes as well, or tribal nations or sovereign tribes, so however you, if that is indeed part of what you're doing with the work. So that's my one, like,
Thanks, Brian. That's really
Let's
helpful.
pause and take action on that. We all agree the vision should include both Oregon and tribal nations.
I mean, I kind of go back and forth on that, if I'm being honest, right? Because like my having a vision for the tribes, like who the hell cares what my vision is for the tribe? That's not my business, right? Like my vision for the tribes is that the tribes get to do what the tribes want to do with the money that we give them. And that's the relationship that we have, right? Like, here's your funds, go do well for kids and families in the way that you do.
And
we do.
And they do
And we do
amazing
things
things,
our
like
way.
kind of, I'm like,
Yeah.
can we just learn from y'all about how to actually
better.
be silo and make things work better? So I'm not saying we shouldn't be mentioning it, but like, I don't know that my vision applies to their reality.
and
actually
I know we're not speaking to each other, I'm gonna speak
Come
to
to
you.
me. Bring it on. You're never allowed to talk again.
Come on, Brian.
We don't,
text your dad?
actually don't have the word, sometimes a mission describes the what and the who and the where. So it's in our mission statement that things are happening in Oregon and in tribal nations. It's not in the vision part of our stuff.
Gotcha.
So we put it on the other side as this happens here.
I misunderstood you. I apologize.
No, you.
That's
no.
why you gotta talk to me.
So that's important. And I will add, since I just took the floor again, the outreach and the communication, that's, I mean, I'm a, with Jesus, like, y'all, we can keep talking. People will hear from people. And when you actually start talking to them about what the work that you do, you need to be in relationship with them, with them, and all this stuff kind of matter, but you just need to be able to talk to folks from all parts of Oregon and tribal nations. And then you need to do your outreach. We're trying to do more of it. People don't question when I'm in Pendleton or in Ontario. What you use this word, they just want to know, am I going to help kids and families in their community? And am I authentic and am I showing up in person?
So I had Adam's hand up. That's gonna be our last comment, because it sounds like people are feeling close and I'm watching the time like I promised and I gave myself 5 minutes. Why do I do this to myself? Adam, close us out in a good way.
Yeah, I was gonna say of how we shifted it to being organized in an accountable system change. One of the things that I'd want to see come out of this retreat is for us to do some work on what does that mean for SOCAC to hold system to create accountable system change, and like what tools do we have in our toolkit to do a little bit of an inventory on like, here's the things that we could do, here's how we engage with other systems to ensure that we're holding up that end of the bargain, because I don't want to put it in there and not to feel like we have the tools to do the thing that we said we're gonna do.
I love that. I'm gonna set
I'm
the.
sorry, Addie. Can I change the word accountable to transparent? I feel like that is the communication challenge that we have, is that people don't know what accountability means or looks like and don't believe that what's happening is happening. But if people could see it, they could determine for themselves what accountability looks like.
Robin, you had a thought on that?
I have a thought on that. Transparent isn't an action word. And part of our problem is we can be as transparent as we can. And a great example here is looking at CCO contracting and things like that. We, network panel adequacy and the issue that I talk about all the time. We have CCOs that are not behaving appropriately in the kids space in this state. They're not contracting for the full network panel of services. They're not contracting for the things they need to do so children, youth, and families can get the services that they need.
Preach.
And the agency who oversees those contracts is not holding them accountable. This system of change council, system of care council has the opportunity, and I go back to what Sophia, I think you were saying, when it's like talking about bringing in OYA. Why can't we bring in the CCO directors and go, come on, people? Here's the lived experiences of children, youth, families, and providers in working with you.
So I'm gonna circle this back to Adam and
So I go back to change.
I think
Sorry.
I'm gonna
didn't
push
mean to
back
get you-
Anna and say, I'm hearing accountability is really important. I'm hearing, I'm hearing it's already happening. I heard a lot yesterday, Adam, and we haven't all gotten to see all of it yet, because like I said, I did decide to sleep last night, womp womp. In the action plan, that's where we're gonna talk about it, and we're gonna get to see it a little bit in the strategies. I just wanna set expectations, because you're like, I wanna leave here knowing, and I want that for you too, but you might not know all of it.
And
Because we're gonna have more.
I guess what I'm saying is if, like, we may not know everything and we're not gonna know everything but in order for that to be in there and for me to feel good about it, I would
Yes.
wanna know we're gonna have continued conversation about
Love
what
it.
that means and how we move forward with that is what to me would then become an essential function of this council.
And I want to remind people of, in spite of Anna being like, nobody spends time with missions, nobody cares, which breaks my little strategic planning heart.
Sorry, honey.
It's
I know,
so
right?
What I just want to remind and is the triangle I put up yesterday, vision, mission, goals, right? These are all going to flow together. So part of what we're going to do is do a check this afternoon if we get to it, which I'm really hoping so, on our vision screens, on our GARE analysis, and are we driving in the right direction? Because otherwise we're gonna get creep and we're gonna get lost and we're gonna get moving. This is the last comment, please and thank you.
I'm happy to wrap it up.
Perfect.
I did receive a comment that I'm gonna keep anonymous. They didn't say what
Okay.
they say.
Great.
And it says, quote, "We can say whatever we want. It matters what we do." Feels like a perfect transition
Yes.
into like action stuff, but I also will just say for myself in this role as like if we start to do outreach, especially for youth and families, like I will hear what you all are saying and take that terminology out of outreach materials. That does not, like, we do not need to lead our outreach with the mission or vision statement, right? It's
We have to lead them.
it's a different conversation
Yes.
about how we
knocking
communicate
on
our
doors.
work versus what the paperwork says our work is. So at least for me, people live like we're together on building that outreach stuff.
Part of equity is meeting people where they are, right?
That's right. We're gonna be people with our, Jaylene, you promised to deliver on a platter and you did. Can we live with this mission statement? Will anyone quit SOCAC or walk out of the building? And it's okay, sort of, if that's your answer. My heart will be broken. Just kidding. Honestly, are we good? Did we get to a place where we all gave a little and we all got a little? And we feel like this reflects where we're headed and we can move on to talking about how to get the damn thing done.
Yes. One can complain about 2 months later.
Okay, we're taking 5, so I can take a break and use the restroom. And then we're gonna come back and I'm gonna figure out how we get our way through the afternoon. Thank you, everyone, for really great work.
Oh, yeah, I gotta cut it out.
This is a huge Oh, yeah. I was building Monday.
Hour and 20 minutes. More than where I think they thought it was going.
Yeah. Okay. Hi, Tom. Hi, Tom. The conversation we're gonna have right now, and we're gonna do categories, which I haven't gotten to facilitate with you in person yet. We did a little bit of it, but I was away. Is what does this look like, right? So if we attain goal 1, which is transforms the systems that serve youth and families, what will we see as a council? So this goes back to all that accountability conversation. How will we know we have done it? I am gonna set the annoying strategic planner parameter up in 4 years, right? So what does it look like 4 years from now if we have meaningfully taken steps to transform the systems that serve youth and families? I'd like everyone to write 2 sticky notes. So if you need a sticky note, they're out, but I'm happy to toss them around. Anyone need sticky notes? Yeah. Sticky notes.
And
Oh, yeah, the stars are very special.
You have a good one?
Would you mind passing me that blue sticky note? I just wanna like.
2 things that you will see, that you will know. Remember, we're gonna do outcomes with the data committee. So this is, if I look at the work being done to transform the systems that serve children, youth, and families, and we use these 5 strategies, what will I see in 4 years that tells me we have taken these steps? Right? 2 sticky notes, 2 different things you will see that tell you we've moved towards this goal. We may not have accomplished it, but we have meaningfully moved towards this goal. So I'm going to give everyone 4 minutes, 5 minutes. No need to overthink it. This is a little bit of a popcorn exercise. But if you look at the systems and if you look at the work of SOCAC transforming the systems, what will you see? So just as an example, I might put a community piloting a whole new way of providing services to children, youth, and families, right? That's a real basic, boring, obvious one because I'm real basic, boring, and obvious. It's what it's going to look like to you. So 5 minutes on the clock.
Goal, but not specifically strategies, just those are the strategies we're using.
What's it going to look like? How do we know we've achieved or moved towards? As you can see on the backboard, it's the results question.
She said goal. If you take all those strategies and you compare them, now do not. Yeah. With that being strategy 1, who's supposed to have that shared understanding? Everyone who's helping us transform. So kind of like all word. Mission statement. No, it's great. There's the transform the system. I told you it's a by working with agencies, so that actually people will do it. Impact.
Yeah, you don't need to understand.
Well, I
You
think
need to understand.
if you look at 2.
Are we just doing the whole thing? This is for the whole thing. This is all for goal
So we're just
1.
doing 2 and if.
2 for the whole thing. Yeah. Sorry. It's hard to make it. I'll see if we can't get it so you can see the goal also, because that's what we're talking about.
I think we're cute, and I would be the type of person who would say, you have my kids, okay? Yeah. Oh my gosh. Oh no. That's awesome.
So we're filling in the results box just because I got a couple questions. So it's with this goal, using these strategies, how do we know we've moved towards the goal? What does the result look like to us, right? You see the little box that says result in way too small? That's what we're thinking about. 2 things we'll see. And the strategies we've identified to move towards that goal are the ones below. So I'm going to scroll back.
I only get 2 sticky notes.
Only 2.
Hi. I'm representing an entire state.
I think what we'll hopefully find is lots of sticky notes come together, right? Because we're gonna work with everyone. Couple more minutes. Just like yesterday, these will get easier because we'll, move these muscles and we'll practice the activity. First one's always a little tricky.
Sounds of it, usually it's working.
Still seeing some people writing, so I'm gonna give the 1 minute warning.
One note per strategy.
Yes, please, one sticky note per two, like 2 sticky notes, 2 results you're gonna see. Total result for the whole goal, transforming the system. Does that make more sense, Jackie? I'll roll it back up. I think visually it's easier to see the other way.
Yeah.
What game does sticky note of the voice?
For just whatever. I think it's 2 sticky notes total though. What happens? Like, happens.
Oh, okay.
Am I wrong? I could.
I thought it was 2 outcomes per
Sorry.
strategy.
Okay, let us go.
Not having.
Make as many sticky notes as possible.
I just wanna like,
There was one time
I
where
kinda wanna
Adam
be
went
like
on
an anarchist.
vacation and we sticky post-it note his entire office. Like, you remember that?
yes.
Being that in all the walls, every desk, computer, some way.
This one,
You guys just wasted $100 in office supplies and now my office.
okay, we're gonna bring it in. I'm gonna try again to explain this, because I don't think I did a very good job.
Right.
So I'll own that. Here's what we're talking about. We're looking at goal 1. You guys know goal 1. It's up here. It's up here. We came up with 5 strategies to get us to goal 1. Those are the purple. The green doesn't show up, which makes me sad because I like green. Those are the purple. Those are the strategies we talked about yesterday. What I want to know is for each strategy later, Cody is going to do a cool process with the data committee where we do the outcome. What does that strategy look like when it's implemented? Today, we're stepping away. We're going back to Anna's favorite, that east 1,000-foot view. What will we see as providers, state agencies, community members, people with lived experience? What will we see that tells us we've moved towards this goal by using these strategies? And I'm calling that the result, right? What does it look like? Because we want the data, we want the outcomes. I want the data people to do that because I'll set us all up for failure because I'll be like, we're going to measure this. And Cody will be like, never in a million years. So, but this isn't about that. This is what we heard a lot of yesterday. This is the qualitative, right? This is what it looks like and what it feels like to us. So if you need to change your stickies because my first go in explaining this was bad, take your time and change your stickies. If you feel like your stickies are right, will someone kick us off by sharing what their sticky said this will look like? How will we see? How will we know we've transformed the systems or taken steps towards it in 4 years? Yes, Cindy.
So, well, one thing that I said is what I would like to see is a less clinical and a more lived experience led way of supporting our youth and families in our communities.
Can I have your sticky?
Yeah.
Who has a sticky that's pretty close to that same idea? Raise your hand. Okay.
Mine is culturally responsive programming run by the communities that use the services.
Okay, close.
Mine's similar.
Okay, what do you got?
All system partners trained in how to properly engage with who they serve.
Okay. What do we got?
I have legislative priorities that actually reflect what the need is as described by families and youth.
Okay. What do we got?
I have nobody is left behind, all are represented and have the ability to sit at the table and participate in community care.
All right. What do we got that's similar to that? Focusing on centering lived experience, making it a part of how the services are delivered.
Services are centered on a person's need instead of systems need, so one needs assessment makes a child or youth eligible for services from multiple districts.
Love it.
Youth in real leadership positions, not just conversation.
Hey, yes.
Not anonymous.
Great.
Better engagement with systems, with opportunities for families of all backgrounds without multitudes of barriers.
Can I ask you, Doylene, to put that on a sticky note or I'll lose it and then I'll add it to the stack? Anything else that goes with this theme in this stack? We're gonna do this on a couple themes, a couple stacks, of course, Robin.
Families have equal access to services they need wherever they are.
All right, equal access wherever you are. You're gonna grab the pie. Don't lose my pile to theme.
Peter has a hand up.
And mine might be,
Okay.
it's green on green. That was smart of me.
Something I would do.
More youth and family involvement in quantity and quality.
Hey, great.
One more anonymous. More families taken care of in their communities, more accessible resources, better communication among systems towards how families are addressed.
Love it. Thank you for putting on a sticky. Did you have one that goes with this theme,
I
Jackie?
think so.
Okay.
Families and children are able to get their needs met when they need it. Access to services, not a barrier.
Okay, so we've got two themes in this pile I'm hearing. One is the theme of you're getting the service you need when you need it without jumping through a lot of hoops, right? Does that feel like a fair, not everything we've heard, that's one bucket of what I'm hearing. The other bucket that I'm hearing is our families and our young people with lived experience are meaningfully a part, bottom to top, top to bottom, not just getting the services, but in the design and the policy making. Am I capturing what I'm hearing? Okay, yes, Caleb, what do you got?
I have system collaboration of partner organizations and councils / committees, information and services access integration.
Okay, so this to me is a whole new theme that we're gonna tackle. This is, we've got systems that are collaborating, we've got partner organizations that are working together, we've got stuff that's not in silos, to be really specific and technical. Who's got non-silos? I know that's not exactly the word, but collaboration.
So
happening.
mine is local systems of care and SOCAC working in the same direction with alignment and collaboration.
Okay, so we've got the LSOCs and the SNOCAC. I know no acronyms, locals and here working together better. Okay, no silos or better integration of the local and the statewide. Silo, no silos? No silos, love it.
I got one.
This is also serious.
Regular accountability report outs from systems.
I'm gonna pause really quick. Are there any more no silos or are there any more? Let me grab all those and then we'll do the next theme.
I mean, it's
Mine's a little
commonly
bit-
used language.
Mine's passed legislation
Shared
codifying
across
cross-sector
system?
collaboration.
Yes, that definitely goes. Hold on, Anna, that's different.
I think
I'm getting all my steps in. We have no silos, no silos. Any more takers on no silos, real meaningful collaboration? It's sort of that one system idea that some of the groups were talking about yesterday. Okay, and then we've got the local, if you want to put these under results. And then here's its own pile.
Make
All right.
decisions, youth-led policy, acknowledge at statewide level.
Okay, so we've got this that's gonna go with our youth and family voices, bottom to top, top to bottom. Okay, now, Jesus, you had a new theme for me to kick off.
I thought it fit in the other team, but maybe it's
Oh, I'm
fine.
sorry.
You're fine.
It's
Regular accountability report outs from systems.
regular accountability report out, so,
Accountability stake.
oh,
SOCAC able to hold system accountable when not collaborating effectively.
I just would like to give Adam a high five for bringing solutions to the concern he brought earlier, which is how are we gonna be accountable?
Very specific, same thing, and temporary lodging.
Okay. All right, other things we're gonna see, new themes. I've got accountable. Any other accountable? New one? Okay, Andy, what's our new theme?
Accountable.
Oh, man, I'm usually so good at this.
Accountability stickies.
We're still I wanna see lots of accountability. If you wanna know my love language. All right, here's accountability. Okay, new theme,
Question over there. No? Oh,
new
sorry.
theme.
Andy first.
Okay, Andy, new theme.
Public awareness statewide.
Public
better PR.
awareness, better PR. We just talked about this. Anyone else?
want more in Malheur
Better
County.
PR, more awareness, understanding.
Drop your plug now.
Anyone connected to SOPAC is confident and able to communicate about the work of SOPAC.
Yes, anyone connected can communicate about what we're doing.
Out there, but
Some
no one-
PR, you got some PR for me? PR.
Here, this
Who's
is
got
the,
PR?
Any.
Any, I'm coming at you, Lindsay. Thank you.
Check our resource list, because we have.
Oh, love this.
the
Love
orientation meetup.
PR and PR for the purpose of families knowing where to go.
Yeah.
Here's PR.
PR.
Here's PR.
No.
Jackie, new theme.
I just, funding for services for children has no gaps, issues with staffing, and is a healthy workplace to support the community.
Okay,
Here.
so funding for services for children has no gaps, and we've moved towards getting better on our staffing issues, and there's a healthy workplace. So the folks who are supporting our children and families feel supported. Is that an okay?
I think
Yes.
this one's similar.
Okay.
Children and youth are more safe.
Children and youth are more safe. Is anyone else sort of, our children and youth are more safe, more well, our staff are more supported? Any others on that?
Money?
We had a money one.
Yeah.
We definitely had a money one, a funding. All right, other themes I'm missing. Sonia.
Yeah.
Well, I think this might be connected
Can you
to
make?
any of them.
Oh, great.
Youth and families experience coordinated care across systems.
Yes, that's kind of bucket one that we first started talking about. Coordinated care. Youth and families are experiences one coordinated system.
Mine's low key connected to that.
Let's take
Mine
it.
is a consistent universal data database. to help with
Okay, so the
coordinating care.
data in the systems goes together. Okay, I'm coming back to Dan and then I'll come over to you.
Council meetings will be organized around actions and results linked explicitly to our transformation plan.
Whoa, I want to snap at that one. Okay, yes, Jenny,
Okay, this is culture shift. This is all the way up.
let's do it.
A
here.
system that understands and supports relational health and mental health and seeks to address what is underneath children's distress behaviors instead of focusing on modifying behavior they don't understand.
That sounds transformed to me. Anyone else with something similar? The focus of the system is really understanding and supporting, seeing symptoms, not diagnoses, working with.
Mine is, it's different. It's about a robust infrastructure built to support the work. Like, we do not have a robust
Okay.
infrastructure. And then a halt to OHA kids programming rollout. It's not what we're already doing, but just not rolling out anything new until we have that robust infrastructure. built. So
Okay.
it's kind of.
These ones are unique.
Except for respite.
Anything I missed?
Except
Anyone?
for respite.
Wraparound.
But you're in the process of that. Like, that's.
I'm just
already-
saying.
Any?
Like, let's just.
At least give like.
No, we're just
sorry.
not, it's okay, totally fine.
Respite. I have a new one.
Any other themes on this goal?
Oh.
Yeah, you're
I
good.
think
We're
this is
wrapping
the
up.
goal.
Lower kids.
The number and type of children served by systems better reflect community demographics.
Okay, so getting rid of disproportionality or eliminating disproportionate treatment, et cetera. We have demographics met, or on the flip side, I should say, that's very child welfare and juvenile legal system focused. On the mental health side, making sure there's access for youth that need the access, et cetera. So it goes on both sides. I want to say that the fullest way. Any last, what we'll see in 4 years if we've moved towards this big goal?
Maybe more outcomes.
That's all right. Let's see. I can hand it to Cody.
Personal to me.
Yes, love that. Substantially fewer youth, I actually think this goes in this one. Substantially fewer youth presenting to emergency departments in psychiatric crisis.
Yes.
I think you're on it. Last call for goal 1. Okay, we're gonna move, we didn't need you.
Oh, perfect.
We're gonna move to goal 2 and we're gonna do the same activity. I think we have a sense now of what we're up to. So maybe I'm gonna move to goal 2, maybe, I don't know what I'm doing. Let me get to the next slide quickly. There it is. Yeah, I can make it a little bigger. Okay, here was our goal 2. And our 3 strategies, if you could scroll down just a little so we can see the goal. Remember, we're filling in together this results box. We're giving me the fodder I need to write up, not the outcomes for each strategy. We're going back up to the big picture. What is it gonna look like? What is it gonna look like if we improve access? Remember, this isn't transforming the system. This is working in the current system we've got that we don't love. What is it gonna look like in 4 years to improve access to coordinated, integrated, and community-based systems of care, right? That's our goal. What will that look like? These are the strategies we put together and wordsmithed and got out yesterday. If we're using these strategies to get to this goal, what will we see as providers, state agencies, community members, people with lived experience? How am I gonna know qualitatively? We're gonna do the quant stuff. Qualitatively, we've made some strides in this direction. We're gonna get through one round of categories here, and then we'll take a lunch break because I know I'm getting hungry. So same thing, 5 minutes on the clock, 2 sticky notes, 2 things you will see or feel. We had super great examples. I really thought I messed up in explaining it, but clearly you guys are smarter than me because you still gave me awesome results for goal 1, so you're on the right track. Oh, yeah. Oh, yeah.
Another, they'll be able to access this.
Anna, we're writing, what will this look like? What's the qualitative? How do we know?
Statewide standards.
If a families that needed it.
Couple more minutes. What would this look like? Working in our current imperfect system, how do we improve access to coordinated, integrated, and community-based systems of care using these strategies? Ooh, our mailbox is looking full. Have fun. Seeing people, I'm gonna give the 1 minute warning. I'm seeing people wrapping up. I feel like it's like a little bit of a personality test. Do you use a marker? Do you use a pencil? Do you use a pen? Do you use both?
Whatever's closest to you.
Whatever's closest to you.
The first day I only used colored pencil.
That saw me yesterday with my one really big fat Sharpie, and it's like the one thing I protect. None of my It's the blue one that wrote all the signs. My favorite fave. Okay, who, maybe it's someone who hasn't leaned in as much and wants to kick us off with a result they might see in 4 years that shows us qualitatively we've improved access to coordinated, integrated, and community-based systems of care. All right, Kayla, what do we got?
Access to available and culturally responsive peer and family navigators. And support.
Peer and family navigators. I'm guessing we have a couple more sticky notes with peer and family navigators.
Yes, families are able to access care in their communities regardless of their ethnicity and where they live.
Love that. So this one's about access and this one's about access specifically to peer sports, peer navigators. So anything on those two themes?
I don't know what.
More youth and families stepping up to lead the work. I think that goes with peer.
Right?
I got local resources strengthened and expanded.
Ooh, local resources strengthened and expanded.
Local community-based providers consulted regularly.
Yes, those definitely both, I think, go with them. Yeah. Okay.
I think both of mine might go under like access. I've got, no one's mad at me for this one. Youth respite without parental infringement is
Okay.
the one that I put. And then more third spaces such as free community programs.
Third, I have been learning a lot about third spaces lately. So third spaces, that's more services and respite care availability, specific services that'll be available.
More better access to local crisis response team with less law enforcement involvement.
Okay, crisis response without law enforcement involvement. So services in the community by the right providers for anyone who needs them.
Children are not being removed from their homes and communities in order to access care.
Okay, you don't have to be removed to get the care you need. Care is available. Yes, Kyle.
Pediatricians and family physicians across the state feel more supported when caring for youth with mental and behavioral health needs.
Okay, so we're supporting the people who are caring for the kids and youth.
I love that you said mental and
Oh,
behavioral
I'm so
health.
sorry.
I love that you said mental and behavioral health. I was saying, less behavior modification, and more treatment options, such as OT, PT, speech, and, other psychology-based treatments.
Right, more treatment options. I'm gonna come to you.
Anonymous, the opportunity for a better, brighter future towards how families are treated in each system by bringing awareness, accountability, and communication.
Yes, this anonymous is a
And
strategic writer.
families with all needs are better off than they were in getting appropriate care for each individual diagnosis without being dismissed.
Love that. What a great way to talk about access. Okay, I'm coming around the west.
Service connectors, peers, family support are available without wait in every community.
All right, we've got that peer support again coming in. Sorry, Robin.
No wrong door ever.
No wrong door ever.
Wrong door.
Nice.
Hey.
Children staying in their communities to receive comprehensive services and marginalized communities are receiving the care they need in culturally appropriate providers.
Okay, so all about that. The care is happening in communities, for communities, by communities. Access, full stop.
More access.
More access, more access, more access.
All the access.
You get a car, you get a car, you get a car.
Mine is funding.
Funding, okay, hold on, that's a new theme.
Access.
Last chance on services and access.
I have access.
Just access, thank you. We're coming back for funding in a second.
It says access.
Okay, sorry. Access. And don't worry, we're gonna capture all of the exact words. I will be spending lots of time with these sticky notes. Okay, last call on access and specific services that will be available.
Workforce reflects the population served.
Okay, workforce reflects population served.
And
Right here, Carrie.
A workforce one.
Workforce.
I also have supports and services that are available in communities that people are already a part of.
Okay, the supports and services are in the communities like we've been talking about. Did anyone else have a workforce related? Because I think we're onto a new theme here. I wanna check on that.
Practitioner mental health worker retention.
Okay, so supporting the practitioners, mental health workers, supporting the peer support people, getting a reflective workforce. I've got access, I've got services.
Intersectional children and families are not falling through cracks because of siloed systems.
All right, making sure all young people and families are served, not because of siloed systems. All right, new themes. I'm opening it up to new themes.
So I just put more funding opportunities to assist with community needs.
Okay, more
Workforce and infrastructure.
Got it. More funding for service providers, so more services can be available.
Exactly.
Thanks, Cindy. That's a good one.
That's a me too.
That's a you
Yeah, it's
too.
more dollars for local systems of care to complete the work.
Yes.
Okay, more dollars for local systems of care to complete the work. So getting our service providers more funding, getting our LSOC's local systems of care, the funding to do the work. Robin,
Reduce barriers to services, including payment and administrative burden.
some good.
Let's reduce that administrative burden.
Reducing that administrative burden as part of it. So getting service providers paid.
More administrative.
Dan?
Service providers across systems know how to connect people to services available through a different system.
Okay, so I love this one because, right, we haven't transformed the system yet, but even within our siloed system, we're helping folks know how to get between systems better. So it's that three-inch step we talked about a lot yesterday. You have one too.
Like slightly connected state agency level data sharing agreements allow for seamless system information integration.
Okay, data sharing. We'll see data sharing across state agencies.
Not data sharing, but data outcomes, what we'll see in the data.
Okay, well, we'll see in the data. Love this. I'm gonna walk this right over to Cody. Cody, I'm gonna hand these to Cody only because he's gonna use these as we start to have our outcomes conversations.
I was sharing for you, Adam, when.
Thank you, Cody.
That would be great.
All right, did I miss?
Another data.
Oh, data.
This can go over to Cody. It's just numbers, just the increased numbers in the community.
Okay, increased numbers, specific numbers. We're coming over to Cody again. We're staying qualitative. Any other new qualitative themes about what are we gonna see? How are we gonna know? Alicia?
I have parents and caregivers are not blamed for the needs or conditions of their children and youth. I.e. less parent blaming and shaming and more collaborative and proactive solutions.
Yes, love that. Other new themes, anything I've missed here on goal 2?
Multiple systems stepping up to be responsible for barriers.
Oh.
Potatoing.
No hot potatoing. So folks in the system are the ones stepping up to say, let's break down that barrier or find a solution. It's like someone was listening to our conversation the last 2 days. Anything else on results for goal 2? Okay. Oh, we have new themes?
Dismantling the
thank you.
disproportionality of the demographics that are allowed in rules of policy decision making.
Yes, love that.
Good one.
So getting rid of the disproportionality where decisions are made in the room where it happens for people who really like Hamilton.
It happens?
Thank you for the snap out there.
I'll sing the.
Other themes on goal 2. We'll take anything now. It's whatever's left. We're batting cleanup.
Is that a data thing?
It could be a data thing, actually. Yes.
Not just.
Thank you for that, Brian. You're right. We want to be holding down.
Also,
Yes.
could you
wires.
send participants the photos of the 4 posters
That's right.
of what you guys?
Yes, once we're done.
Like at the end of it,
Yes.
because.
We'll also type it up.
I know, right?
Okay, really important decision, the hardest decision we've made all day, like almost harder than mission and vision. It is 12:30. I promised people we would be out of here by 1:30 today. The one thing I usually do as a facilitator is keep that promise. We have 2 options. If we want to do a working lunch, I can probably get people out of here by 1:10. If we want to take a break, half an hour for lunch and then come back and do the last half an hour, of facilitated sessions, we'll get out of here by 1:30. Would people like?
Lunch has not arrived yet. They're stuck in traffic.
Oh, just kidding. All right, we'll keep going. We'll try and end early.
At least that's what they said.
And
I
you
don't
know,
know
if we
how
take
much
lunch-
traffic you bump into.
Lunch on the go. Say well. There's like
When you run into the
traffic.
If you are hungry.
There are no bagels if people are in need of emergency food.
All right, I think we may have an option for a break activity. I'm looking at Joylene.
Oh, geez.
Right now.
Yeah, right now, because we need a breather. We just did 2, we have 2 more to go.
I love doing this.
I have like.
Not a silly.
It's not silly, but we can do it silly after. All right.
Actually.
I feel like we have some art that is going to be shared with us as a different kind of activity and break. So
Dance?
I don't want to introduce you wrong, but
This is interpretive. You've just been circling all
Yep,
day?
uh-huh.
How do where do
I think if you stand in that corner, you're best suited.
Can't wait for your TED Talk, Joylene.
Thank
Make sure
you.
you look everyone in
Hi,
the eye.
everyone. I wrote a poem for you all and I want to share it. So please do whatever you need. Before I dive in, it is showing you a little piece of me in this. It's called Bridge Work. In Oregon's mist, where the tall cedars stand, a patchwork of voices reshapes the land. From coast to high desert, from city to farm, we gather with hope, not to silence but arm, each heart with a story, each hand with a tool, to mend what's been broken, to rewrite the rule. Disagreements once split like a river too wide, but bridges are built, not to push, but to guide. Not all think alike, and that's part of the thread. The tapestry strengthens where dialogue is led. We come from all angles, from systems and streets, where power and privilege and lived truth meet. Across agencies, sectors, and silos of role, we're learning to center a shared human goal, to protect Oregon's children, youth, and kin, no matter what barriers life brings in. We name what divides us, the weight and the wall, of race and of history not felt by all, of mental health struggles, of substance use and pain, of bodies disabled, of trauma and of strain, of grief carried daily, unseen and unheard, and the wellness that flickers with each kind word. This work asks for courage, not just the loud kind, but the quiet resolve to stay open, stay kind. The bravery that it takes to simply appear, to listen with care, to sit with the fear. And still choose connection, still choose to share. The labor of justice, the gift of repair. We are tending a garden, not one of quick gain, but of rooted commitment through joy and through strain. The seed is our vision, the future we sow, the thriving of families, the systems we grow. It holds all of our children, our bold policy dreams, a more just Oregon beyond what now seems. But the seed cannot flourish in hardened ground. It needs soil that honors where pain has been found. Soil made of stories of loss and of grace, compost from struggle that we are willing to face. It needs sunlight of equity, fierce and clear, to cast out the shadows where bias draws near. It needs water of care that is trauma aware and sees all abilities, meets needs with repair. It needs us to notice, to pause and to tend, to co-create systems that listen and bend. Because gardens don't grow from intention alone. They need steady, informed hands, not just stone. So this is our call. Let us partner in bravery. Let us move with compassion. Let us lead with justice. Let us act with hope. Let us walk with grace. Let us root in equity. Let us choose integrity. For policy's promise is only as strong as how we treat people when things go wrong. So from kitchen to council, from clinic to hall, let love shape the systems that should hold us all. Oregon grows not by force, but by will, of communities rising together still, hand in hand, heart in heart, making it true. A well-tended future for me and for you.
Wow.
A new mission statement.
Yeah.
Charlene, that was beautiful.
Oh, beautiful.
Sharing.
Vision and mission.
It was a little awkward with the vision things in there.
Vision was easy. This group was like, vision done. We know where we're going. Love it. Thank you
Appreciate
so
you all.
much.
Tom said that was so beautiful.
Yeah.
Thanks, Tom.
All right, let's get through this and then take lunch off. Okay, can we move to the next? Let me see if I can do it this time. Last time I
That was incredible.
awesome.
Charlene, let's publish that. Can we publish that in the newsletter?
We should do
Yeah,
it.
can you send it out to us?
Will you send it out?
Awesome.
I've been writing for a while.
Do a fundraiser of poetry. It would work. We live in, I live in Portland, and it would just be like. Start bleeding.
Whoa.
Amy said beautiful.
Man, I had it.
Everybody can read that, right?
I have a different co-consultant I work with who literally has like a Addie don't touch sign on the tech.
You break it?
Oh, yeah. Goal 3, please. 2 over 1. We've already done this one. Whoop, whoop. Other way. One more, please. Yes. Okay, this one's a little small. So you guys get the idea now. So we'll focus on the strategies because you're less familiar with those, so you can see those. You know the goal is over here. So this one is promoting the co-creation of equitable policy and systems by providers and the youth and families they serve. Same thing. What's that going to look like? What's the qualitative look like 4 years from now to tell us we've made some progress getting in this direction? And Christy, if you want to scroll up, I think that way we can really see the strategies we wrote. So take, again, 5 minutes and then we'll do same idea. You guys are really getting it because you're getting ahead of me on this categories.
Sticky for this one.
There we go. You can repeat old stickies if it's a better fit here. And sometimes when I'm sorting the stickies later, if I see it, I might move it. Still seeing some folks writing. We got one more minute. I feel like I should have brought my roller skates for this today.
Do you have roller skates?
My very first job was at a roller rink running birthday parties. Yes. Just a fun fact about me that I don't really often share.
Elliot?
Say that again.
Have you met Elliot?
I haven't known Elliot that long. Sadly, I met Elliot at a work group. A fun work group, but not a roller rink. And Elliot's a way better skater than me now. I'm rusty. I put my toe stops back in.
Go to Oaks Park, free skate, Saturdays, 2:00. Be there, Annie.
Okay.
Be there, Annie.
I will be.
Just got some blades. I'll
Promote
join you.
sustainable change.
Yes.
That's where we're at now.
Yeah.
I know.
Stay in Oregon.
Promote the co-creation is where we're at.
For rollerblading, I would change my flight.
Co-creation.
Oh, wait, what was our?
Do you want to see the goal again?
Yeah.
We're on goal three, promote the co-creation of equitable policy. And there's a typo of equitable policy and systems by providers and the youth and families they serve. So that high level, what's the scaffolding that the system sits on and how do we ensure that it's being written by everyone together in that way?
I'm not good at politics.
So much easier.
Okay.
Count the widgets. Do you have 10? It's all about the balance. It's all about the balance. Practice-based evidence, not just evidence-based practice. So we're talking here about how we're gonna do a little bit of a reset on how we engage with youth and families to make sure they're coming to the table, at the table, willing to be at the table, feeling good at the table. We're gonna talk about then doing the writing, getting it done, fixing policies, making them different, making them better. And then we're gonna talk about how are we looking at the data that tells us, have we rewritten them in ways that are meaningful?
There's your train of thought.
All right, what do we got? What are we gonna see? How are we gonna know we've done that reset? We've gotten some of those policies changed or are working on the policy change and the data is showing us that we've done it right. Annette, kick us off, please. All right, it's gonna be community-based organizations who serve racial and ethnic populations are at the table and no one is excluded. So we're there, we're seeing them, we know it's happening. And we are going to be doing that better outreach to communities who have been excluded from the process. So not just asking them to come to the table, working with them to find out what they need to get to the table and then getting them what they need to get to the table. So who's got stuff about that? All right.
Youth and family always present for all conversations.
Okay, youth and families always present for all conversations. Yes, Alicia.
Every school has a SPED or a special education parent advocacy committee that provides opportunities to problem solve and find proactive solutions to students with IEPs, 504s, and those using pre-SPED interventions such as response to intervention.
Okay, one really specific way we're gonna see this done differently. Robin.
People closest to the work, write the policy.
People closest to the work are writing the policy.
Youth and advisory bodies have a rule and budgetary endorsement process for all SOCAC agencies.
Okay. This is probably gonna end up in one of our action steps tomorrow, but I'm still gonna read it out loud because I don't think Wes, you were with us yesterday. Is that right?
I was not here.
Yes, okay, I was gonna be really embarrassed if Wes was like, I was right next to you. This says, youth and family advisory bodies have a rule and budgetary endorsement process for all SOCAC agencies, right? So there's some stuff happening that's forcing some review and some check. I'm just gonna shout us out that gets us towards accountability in a different kind of way, my accountability disbelievers. I'm bringing you along.
Meeting people in the spaces where they are.
Meeting people where they are, not asking them to come to us.
State local council work groups would increase to 51% youth and young adult and families.
Okay.
And provider and agency alignment with what youth and families actually want and need.
Okay, working on provider and agency, I'm gonna give the 51% because that's a number and I said no numbers. That's okay. Over here to Cody, because that's a measurable outcome that I really like.
Also, I'm taking these measure sticky notes and then we'll talk about them during data committee things. So they're coming on with me.
Because we can go down from here to what does that outcome look like? Am I tracking?
Yep.
We're gonna coordinate and collaborate and not be siloed.
family and peer reviewed policy to eliminate discriminatory practices.
Okay, family and peer reviewed policies specifically to eliminate discriminatory practices.
Youth and family equipped with the same tool as others in the room to promote equitable engagement.
All right, we're gonna see youth and families equipped with the same tools when they're in the room so that they can engage meaningfully. So it's not just getting them to the room, it's getting them equipped when they're in the room.
We're on the same theme.
All right, more about getting them in the room with the tools.
Language access for engagement.
Okay, language access specifically so that engagement happens.
I think to piggyback on Gio's, SOCAC pays or supports a youth policy advisor or advisors.
Okay, some paid SOCAC specific youth advisors. Cindy?
Well, it's just bringing youth voice to navigate how we provide services to them.
Bringing youth voice, that's right, that big picture, I love it.
In the room all the time.
In the room all the time.
I think that I've got youth and family, in the big picture, we're gonna have youth and families show up and they're going to be supportive of the work. Because they're gonna say, we like this. And
Yeah.
they're gonna like say it loud and clear.
I love that. So that zoom
That's how
out,
we're-
30,000 foot, I'm sorry, I spoke over you.
No, that's.
Is saying youth and families feel good about being there and wanna be there. Other thoughts on that?
Mine's in that.
Okay.
This is like, it's gonna sound like I'm arguing with some of the points that people are just making, but what I'm trying to say is if we're all doing our jobs well, then this would also be true, which is that youth parents and advocates get to a place where they believe systems when they explain why or how something is hard or something is a barrier.
So rebuilding some trust. Or we'll see rebuilt trust, we'll feel that trust. Cameron, did you have one?
Yeah, underserved populations are the priority, not an add-on.
Okay, underserved populations are the priority, not an add-on. Love that. Yes.
I have 3 anonymous sticky notes. First says universal data library.
That's not numbers. That's still good.
Trying to get rid of some.
Second one
You're right.
says better engagement in mental health and IDD communities by giving each family a voice that might not have been heard or seen. Third one says equal opportunity in mental health and IDD communities by providers and their counterparts being held accountable and held to a higher standard in how they treat those families.
Okay. Love it. Yes.
Along the lines of trust.
Oh,
like
rebuilding
what Anna
trust.
just said, but youth and families feel more confident and comfortable reaching out for help in their community.
Okay.
30.
Yeah,
Million
bring it
mile
big.
high.
That's what I love here.
Build trust, less fear.
Build trust, less fear. Boom. Put that sticky in there, right in the results.
No more surprise policies from the agencies.
I'm sorry, I should laugh. No more surprise policies from the agencies. Fair feedback. Anything else on these themes of building trust throughout, across, and particularly and most importantly with our partners with lived experience?
Council members and local FCC members report decreased feelings of power imbalances.
Okay, reporting decreased feelings of power imbalances. I'm really looking at Cody because that's close, so I'm gonna hold it.
Close. Families and communities, healing families and communities.
Families and communities are healing families and communities.
Youth families see and feel their voice and experience within the system of care, data reports, policy, and practice transformation.
So really specific spots where youth and families are seeing their voices actually reflected back. Part of that building trust. All right, any new stuff that I haven't yet gotten a theme for or grabbed your sticky note on that will qualitatively, it'll show, we'll know, we'll feel we've moved towards goal 3. Yes. Jenny and then Caleb.
Okay. A centralized data system that captures all aspects of needs and is accessible to all because screen readers need to be accessible to reading
Yes.
data.
So the data is,
And I think like that's an important point, like what we mean by accessibility there, like your data should not be accessible to all, right? Like I can't log in and see your
Yeah.
family's data,
Yeah.
but you can log in and see what you need to see.
Yes. And be able to actually see it if you are blind.
Yes.
Yeah, correct. Yes,
Probably
please, Adam.
Payment barriers for professional lived experience voices are resolved.
Okay, no.
Yes.
We're gonna see that, and that's definitely, as you all saw yesterday, one of our action steps too, is taking a look right at that. I'm just leaving these here for Elliot if that's okay. Yes, Cameron.
So data is free to access and can be understood by populations concerned.
Okay, data access. Anything else on data access? Okay, any new themes?
You don't have a new thing.
Oh, thank you for that reminder. All right, Pathways for youth leadership and career advancement opportunities.
Mine goes with that.
All right, anyone else on that theme? Pathways for youth leadership and career advancement opportunities.
Food is fine.
Okay, other new themes. I'm gonna look behind me because I think I keep forgetting this corner because I'm not looking behind me. Are we all set on goal 3? We've made it through all the sticky notes. Yeah.
Sort of. Okay. Oh, geez. No, this might be a Cody one.
Okay, perfect. Cody is available for consultation. I'm gonna volunteer him.
Just kidding.
I can make it not a me one.
No, I'm trying to send them to you. Okay, let's do this. Let's get through the last one and make our way to a relaxed, non-working lunch, shall we? We've worked pretty hard today and I'm hungry, but now I'm gonna touch the tech, so everyone cross their fingers.
Goal 1.
We made it. Is it goal 1 really?
Let's go 1.
Where's 4?
Celebrated too soon.
Oh no, is goal 4 not in here?
Oh, no. All right, 5-minute break while I find the right PowerPoint. Time out 5 minutes.
Oh,
we've got this. Oh, the food's back?
It's
Oh, let's
close.
take a
It's
photo.
close.
Oh, let's take the photo.
They're
Thank you.
They're
We can
setting
tell
up.
them.
food, so we can't, like-
All right, better plans. Thank you. Let's go get the photo and then we'll come in and we will wrap up.
Yes, Brills.
Photo will be in here somewhere. Where are we doing the photo?
Oh, in here? You don't know me already, you don't.
I didn't stand.
Counselor and.
Do we wanna do it in front of the like sticky note board? So it's kind of like, look at the work we were doing. We do it in here. Sure. Yeah. You just have to bring your.
Taller in the back.
Taller people in the back. Jesus, Cody, get in the back. Sandra.
How dare
Get in the front.
You knew that was coming.
Christy, towards the front.
How problematic it's right.
Yeah. Doesn't have to be a huge photo, but if you're wearing heels. I know. Step to the back. Here's out there. Cody, step to the back. Can you run out and grab some beer? That's why I stay on the side. Can you run out and grab some beer?
So much.
Right there.
Yeah. Just lay down.
Yes.
We'll just hold you.
Yeah, we can just hold you. Oh my God, please, can we hold you sideways like that?
That's what I have a wedding.
Stand up on a chair in the back of the room.
What's that?
Sorority squad.
Sorority
squad. But then you have to turn sideways and suck in.
Yeah.
Yeah.
That's not. That's
In a good way.
Oh, wait, it was
You're
tall.
You're a tallie. Shrink to the back, child.
We could call it Skippy Snacks to shrink a little bit.
All the vertically tall. I'm gonna do it
Well, so we
upwards. Try to
say pass that along to the.
Stand on the table. Maybe adjectives. You have to go.
Corinna, Joylene, you are
I'll pick
also a
someone
part
up
of
if they
this.
need to be.
Staff on the ground.
There you go.
Yes,
Yes.
the whole down.
Christy, come here.
Layers.
Okay, I'm gonna take a few, so just be sure to look here and blink a few times. I'm trying to get
So that you can get
faces.
one where we're all blinking?
Yeah.
Everyone say blinking. Yay, blinking.
Am I in it?
Yes, you are.
Hey, blinking.
Okay, got it. Got the serious with their silly.
Sure, is there?
Waiting for the silly. There's a couple. There we go. More silly.
That'll actually be silly, y'all.
Okay. Got it.
Thank you.
Here's all the other.
Oh, yeah, that's different though. You were able to say anytime. No, we're people that were. I'll connect you with.
Corinna, we still need you.
Corinna. One with staff, please. Oh, staff photos? Well, staff and a brief.
Actually, I would be over there if you just signed the contract.
Yeah, Anna, sign the contract.
I will be.
Can you fill out the 7 pages of paperwork?
I'll do it.
Ask
Let me
to
try
approve
that.
it.
You think I do a lot of
I have a shaky hand.
Paperwork.
Snap my fingers.
Right now.
We were a nonprofit, I could do that for you, but we are not.
That's exactly what I want to hear from someone taking
Okay,
a photo.
quick, Christy, pretend like you're part of this picture.
Yeah, that'll do. That's great.
And we'll make it.
Are you okay?
No.
That is very uncomfortable.
Very well.
Oh my God.
Can you please
Did we do it okay?
Yeah.
That's great. Photo with staff, all the stall and like. Who's here? I gotta get it.
Film first kind of thing.
Okay, so I'm gonna admit something really embarrassing, which is it was the correct slide. I just forgot to change it from goal 1 to goal 4. Like even the words were correct. I forgot to change number 1 to number 4. But now we're good. So let's get through this last activity and then take a lunch. So as soon as Elliot's got it up, which we're really close to.
Christy, why is your computer so terrible?
We're, this computer is killing me softly. I'm already really bad at tech. Now my stress levels are rising. Doing some, we got the picture done. Maybe, yes.
Different houses of people who are all going to get to like interview them, they interview you. So you don't just get put with someone. You have to like be like, they're good and then you're like.
That increases
SOC's
when
you guys have some like, you guys sit down with and they're like, this is what lease agreements inside that, right? So like, both parties are protected. In mine, I said that I would make them a public loss. And they were happy.
Great.
A little bit. Sit down, you get that signed, they have that backing, and while you live there, you get rental history. Okay. So if they wanna get
We're
like.
gonna lose them, Elliot. We're gonna lose them. We're all falling apart together. Now we're gonna bring it in, bring it home.
Yeah. Okay.
Yeah, that one. It was just.
Yeah.
Doing this and then also
A philosophy of SOCAC that I might be missing where it should written down somewhere.
Yes, we can make sure you get.
I got you.
I figured.
Yeah. Okay, let's do this, y'all. Let's do our last sort of 10 minutes.
That's
Thank
right.
you for being patient with my late night brain. I really appreciate it. And I'm glad we got to get the picture taken. We are doing the very last one. If you are able to dig in and hang with me, we've only got like 10 more minutes left and then it's gonna be a social lunch and you can leave whenever you feel ready. So same thing here. Last time we're doing it, I know we've got 4 goals, so we've been doing lots of repetition, but taking these, using our vision screens, using our GARE analysis, thinking about what we've got. What are you gonna see? And this will be a fun one for the staff to participate in. What are you gonna see if there's an increase in the infrastructure, capacity, and credibility of the SOC? Gentle reminder, this is the SOC. I know this one, unlike the activity earlier. This is about the system of care, both our local and our statewide SOCAC, how they interact and how they have the capacity to support 1, 2, and 3, the other goals, right? How they have what they need to be the support to make things happen. And the strategies are up here. We looked at these yesterday. You guys got to do a little bit of a gallery tour of what that's going to look like. Part of it's strengthening membership, part of it's improving the local, that's what LSOC stands for, and the statewide coordination. I didn't get the font right on the bottom because I was trying and that computer that Christy has is killing me. So just pretend it's the same font, but it's also getting more staffing and capacity and creating policies and procedures specific to the system of care work that build in capacity and promote sustainability. So let's get what this looks like 4 years from now. How do we know we've done it more? Is it more staff? Is it that we have our locals having a better sense of what's going on, or what's it gonna look like? So just take those 5 minutes. I'm gonna give us until the top of the hour and then we'll collect them and then we will wrap it up. Like lunch is coming. I know everyone feels tired, so I appreciate you hanging with this last one. I always try and remind myself at this moment that this one's just as important as the first one, because in my brain, when I'm tired, I'm like, it doesn't matter.
Right now. Increase capacity and staffing. Very possibly. Yeah.
By 2030.
It's everything's also equally helpful.
Well, aren't scared to get their hands dirty. Figuratively speaking.
I was about to say, that means a couple things.
Figuratively speaking.
Baby. You like to leave it this cheap. Where's the bullshit? I believe in myself.
So cute.
You know, it depends on the day.
He said that he got second traffic, like there was law enforcement or something, and then he.
Just a couple more minutes. I'm seeing some pens still working.
With the speaker.
I feel like it needs to be
It's from somewhere, Sassy Onion, I think.
Yes.
Last minute that you have to use your brain for this today and for a while.
Like I'm ready for lunch.
No, yeah. Yeah, take yours first. Last couple of seconds. Okay, I'm gonna have Chris kick us off because I think our Eastern Oregon friend got to get on the road. All right, what do we have, Chris? What are some themes to start with on what's it gonna look like for increased infrastructure capacity and credibility?
That we have a dedicated funding to grow local systems of care, like a dedicated FTE required, like per county.
Okay, a dedicated FTE per county.
What's FTE mean?
A full-time equivalent.
employee.
Thank you. Which
Yeah.
is like a full-time person. Sorry if you don't know that.
No, that's, and then the contracts that OHA rolls out requiring all system partners to do systems of care work, not just the CCOs.
Okay.
I'm sorry.
That's okay. Bring it. I love it.
OHA doesn't have contracts with all the partners?
Okay, so we've got, what do we got about
That's
capacity and staffing of the local systems of care? Anyone else have something about capacity and staffing of the local systems of care?
How does
Yeah.
DHS
Okay,
switch their?
you got one for systems of care generally?
Yes, like that.
Right, like that the partner agencies are doing their.
Hire youth and family members on a full-time slash temporary basis.
I'm all for that.
Right,
That is
hire the youth and family
That is
members.
the intent.
Yeah, yes.
No, that's.
We got another one.
So again, not.
So part of increasing capacity in general.
I've got
Yeah, I don't
one.
have those teacher looks. I'm trying to give them the teacher look.
Incentives
That's
and
like-
the, like the carrots.
We're having a hard time hearing overside conversations, so sorry. Thank you. Okay, so funding to local systems of care. We've got increased capacity and we've got specifically increased capacity by hiring youth and youth members. That could be a way we do this, what it looks like when it's done correctly. I'm collecting things that look like that. And then I also have, make sure that we've got contracts for system partners from our OHA friends that felt called in, not called out.
Formal agreements at the local level for participation of all the systems, not just behavioral health, active participation.
So getting all the local
Is that
systems
sort
folks
of in that same
That is-
category?
That same category.
together.
Yeah.
Higher use.
Hire youth. All right.
I've got that one.
Coming over and then I'm coming back that way.
All these.
Yes. Okay. Hire traditional healthcare workers. Yes.
Yeah.
What do you guys have?
Lobby for additional funding for a robust workforce, to provide behavioral health services, more funding for peer supports.
Mere funding for peer supports, yes.
Allow youth leaders to be involved in administration veterans.
Ooh, allow youth in the, I will let anyone in.
We have two back here.
Those are tough
And the
to tackle.
funding one that might go with the funding is that if we had this, there'd be alignment of data and advocacy for legislative session 2027 for investments.
Okay, so aligning data and advocacy.
I got a contracting one.
Okay, what you got?
Contractors are regularly evaluated to ensure the work is being done.
Hey, that's an accountability one.
Sure is. I think,
Did you add them?
I don't know, I may or may not have a contracting one or
Go for it, I'm listening.
capacity, I don't know.
If it's in the wrong bucket, I can always
Okay,
shake the
cool.
buckets a little.
And I think it may or may not be a little bit of a, oh gosh, what's the word I'm looking for? Controversial-ish one.
Okay.
Not me, ever. SOCAC and LSOCs, or SOCAC and the local SOCs are their own fully independent agency. So like
Okay.
SOC or
They already have.
its own independent agency.
Got it.
Rather than being associated with CCOs or OHA, and then we can actually have partnerships going on. And family members and caregivers receive stipend regardless of their annual income.
Yes, and that's definitely one of the strategies on this one. So we'll definitely be looking to see if that's happening.
We got one over here.
Come in.
I'm not sure this is great. Select practitioner, but not turnover.
Less practitioner burnout and
No, Joylene won.
over. Joylene.
I have two anonymous, more family reps and youth advocates stepping up to better how we interact with systems, fostering healthy relationships as they go, and better interaction and collaboration with both SOCAC and LSOCs with a wider diversity and growth rate.
Love it. And I like your handwriting. Sheesh. Whoever's handwriting this in there. really
Anonymous
like.
handwriting.
All right.
Love
Okay, local and statewide interacting.
Local SOCs and SOCAC feel they have genuine partners in each other, and we've got established pipelines between the local.
Ooh, I like that. So coordination, partners, pipelines between the locals and the statewide. Anyone else on that theme?
I just roll clarification of SOCAC and SOC with the state agencies and local agencies.
Okay, so some role clarification. That's great because we've got some MOUs in here as action items.
Just in
Local.
Just say it again.
Yes. Yes. Good one. We've got that one in there. I love that. All right. So we've got a lot about the local and the statewide coordination. Anything else local statewide coordination?
An elevator pitch exists for what they do.
Ah, so some communication stuff around local versus statewide.
I don't know how to, but contracts with community-led coalitions,
Contracts with community-led coalitions.
proactive work to maintain continuous community awareness and involvement of SOCAC initiatives with clear and measurable increase towards reported barriers met.
All right. Reporting out what we're doing, talking about it, sharing it. Other strategies that fit these or that are brand new. Strategies, results, ways we're gonna see it.
I think this fits with Anderson's a little bit. Collect data outcomes connected to our goals.
Yep, love it. Last chance. What do we got that's left on what we're gonna see?
Barriers
inclusion?
sent up by local system of care is actually get a trip.
Barriers sent up by local systems here. This is a good one because one of the action steps in here is about reevaluating that process. I love it. What do we got, Brian? Same ideas?
Stuff.
Stuff, okay, stuff and things.
More money, more.
Woo, stuff. More money, more authority. Spoken like a director.
Yeah.
Data, we got data stuff.
The data dashboard is well known and answers most questions people have about system
Woo,
involvement.
the data dashboard is known about and answers questions, other data. Sorry, Dio.
Just throw it on.
Including diversity of staff. This one's from all of the regions of Oregon and each staff bringing their own unique ideologies to the table.
We got a Joylene one, we also got a Caleb one.
You, Caleb, we got a funding one, and then I'll come to Joylene.
Creating a system to credit and recognize family and youth contributions that is seatable, and able to track progressive value added.
Love it. So making sure we're celebrating the wins and especially the value add from our youth and family members. Joylene?
Hire youth and family leaders to lead engagement work.
Ooh, love that.
Sign the contract.
Get me out of a job.
Yes.
Work me out of a job.
Please.
What else? Last call on what are we gonna see when we know we've increased the infrastructure capacity and credibility of the system of care? What is it gonna look like in 4 years? Anything we've missed? Okay, so here we're done. Giving 2 seconds to tell you what to expect. So what I'm gonna do with this, so we all have reasonable expectations, is I'm gonna take all of this and then I'm going to, like I said 1,000 times, write a couple qualitative sentences that go under the goal. They're not gonna capture every single one of these because some of these are action items, some of them belong to action items, some of them are outcome, but it is gonna be a couple sentences based on what you've told me, not what I think. It will look like in 4 years to have increased, for example, this one, the infrastructure capacity and credibility. So you're gonna see it and it's gonna look sort of pretty and flowery and thoughtful, right? It's just that qualitative important side of things. And then, like I said, data committee is gonna go through the strategies and some of the action items and look at, for those who are saying, I really like quantitative data, how do we measure what we're doing on each of these strategies? So we're gonna build in both because a lot of the feedback we're getting is we want qualitative because it's just as important but different than quantitative. So I'm gonna take all this. That's one of the things you're gonna see next time is my summary of all of the good work that you all have done. And that's when you get to tell me where I got it right and where I got it wrong and how do we do it better. The other thing that you're gonna get to see once we've had some time to sort through it is everything from yesterday, but it's gonna come back looking a little bit magical. It's gonna be in a smart sheet. It's gonna have the goal, then it's gonna have the strategy, then it's gonna have the action step. Who's assigned the action step? When the action step should be started or completed by, what any barriers are to the action step. Notes, you guys gave us a lot of good notes yesterday about like, yeah, you can do this, but you need to do it this kind of way in this kind of manner, right? We're gonna keep the action steps short, but there will be a notes section that captures a lot of the information. So it's all gonna be organized. And then there will be I love these, a drop-down menu that is like started, in progress, completed. Because the action plan is gonna become the living, breathing document that you all use moving forward. So that will come to you and there will be a chance for feedback on that. Most of what came up yesterday will end up in there. It may look a little different. We can readjust this if it doesn't feel right. Some things may end up in the parking lot. We'll keep track of that. So it's not like we're tossing good ideas, but we're gonna try and take that and winnow it down into something that is doable. And it will come back to you for conversation there about how to move forward. So you're gonna get in a couple weeks a fully formed strategic plan. Then a couple weeks after that, because I'm gonna take a breath, you'll get a fully formed action plan and we'll have time to discuss them and build consensus around them. So what you're looking for as you're reading through those is, what can't I live with here? What am I embarrassed by? What is super totally wrong? And you're doing that gut check I keep talking about, which is, did I get some more in here than I thought I would? Well, and did I have to give some stuff? Is it stuff I can live with giving? Or is it stuff that we really, really got to talk about because it's embarrassing to me, it's embarrassing to SOCAC. I mean, that's my word. It's not right. It doesn't feel comfortable. That's how we're going to keep moving forward so that we get to a plan that can be executed. And then we were talking about this a little on this side, I heard. It'll be a tool that I'm hoping becomes a part of meetings. Like you're pulling up the strategic plan and you're getting a report on how many of the action items we've completed, how many we haven't, all that stuff. So that's where we're headed. I'm gonna take all the good stuff from the last couple days and winnow it down and bring it in and bake it and then have a product. Does that all make sense? Any questions about next steps?
You're amazing, Addie.
Hey, I want to thank all of you. We're working on the awesome gratitude sticky notes for folks. There is lunch. This has been a pleasure. You guys are a real treat to work with. I have learned so much in the last few days, which is always the most fun facilitation for me when I feel like I've learned a lot more than anything else. And I'm not just like learned about action steps and stuff, like I've learned from all of you. So I just want to thank you. And I really saw, we had some bumps, we had some things we could do better, but I really saw people doing things differently than I've seen in other meetings with this group. And I just really want to commend you. I know that that can take hard work. As a group, we get into ruts right? Or we start to norm, and stepping outside, doing things different, showing up differently is really hard work. It takes a lot of intentionality and purpose. And that I find to be really hard. I like my ruts. I like my grooves. They feel safe and comfy to me. I like being safe and comfy. So I really want to thank all of you who did that. And I want to, remind people it's always good after these, take a break, take a breather, and then reflect on how did I do? How did that feel to me? And you'll always forever have Elliot's cell phone. So text Elliot about it. But I really do want to thank all of you. Elliot, thoughts on as we wrap?
Just appreciation for all of you, again, showing up, spending time with us, figuring this out and bringing out your ideas. There was a lot of pre-work that even got us here, so thank you for that. And just gratitude for sharing space with you all. Like, you all care a lot about this, so you wouldn't be here if you didn't, nor would you stick it out to have the debate and have the discussion we're trying to have here. So I really appreciate that. And just keep showing up and keep stepping in and also being willing to step back when you need to. So I hope that you all also just take a break from this for a day or two to give yourself a breather before you come back to it. So thank you so much for having us.
There's lunch out there. We'll have lunch in here and we'll find a space for in 20 minutes the youth debrief that's not in here that's private, and we'll do the same for the family debrief. Elliot's getting on an airplane, so you won't get to have lunch with Elliot, but be sure to say goodbye to them.
Ready to receive completely unrelated tape ever possible.
I will find you on Instagram and I will find your name.
Okay, thank you.
Straight to the bottom.
Straight to the bottom. Oh, actually, yeah. Quick link to the.
I'm right. Grab your appreciation. Yeah, so I'm back by your name.
By my name. Right.
I'd love to be
So anyway, think about it.
Yes.
Well, that's what I was thinking. It's like it takes you sort of through what it is. Maybe Salma needs to figure out an article like that. You could even connect it to the strategic plan.
Yeah, maybe. Yeah, let me know. Oh, let her.
Not in a bad way.
Elliot, did you get good photos of all these?
Yes.
Any close-ups?
I know. I'm just I wonder what people think.
Say it again.
Did you get good photos and did you get close-ups?
I did close-ups in sections that
Yeah, you have
I just like to
a
zoom out.
spot, let me know and I can.
There's one or two where the writing.
Actually over the spots.
I was just about to say that. I was like, shut up later. Drive safe with friends. Bye. Have fun at your facilitation tomorrow.
I can fix this, show some space for you.
Yeah, for sure.
Our sponsorship will make it slightly.
I know because
Others for while during this time. Other things planned out. Not what's talking about, like, are they work related?
I think it's okay.
Yes. Not work.
My first job.
I had to go to another meeting, so I was wondering if you could just help make sure that things are cleaned up, but if you can't, that's okay.
It was like the
Come back.
Yes, I'll move for that. Absolutely.
Okay.
Thank you, that was so great. I have to go. I have another meeting.
Yeah. I'm just
Good to see you, yeah.
I mean, they have been here. One would hope.
I feel like
Me too. Get in there, Lindsay, by all
Yeah, I got another minute. See you later.
Grab something in 2027. Well, what has happened is we go to a session and there's like, we're not all.
Sounds good.
Aligned and then legislature, the governor's office gets confused. Like, if you start through.
I do approve.
We did it.
Or a sophomore.
Wrangled like 30 people for the summit. Went over 25. Hope that's fine.
Oh, it's totally fine. We can all get in for free. Yeah.
But I did not expect most
Thank you so
coordinators
much.
to be inviting their people, so we have wraparound people.
That's totally fine.
Leadership.
Yes.
That's what
Yes.
needs to happen, because
No
honestly,
problem.
even Kathy can make it, which is a small
Yes,
miracle with
I
her
talked to her
schedule.
about it. Really good.
So yeah, I think it'll be a good turnout. I'll
Awesome.
be there.
Thank you so much for doing
I'm not
that.
sure if in person or virtual. I've just been traveling so much for work.
Yeah.
I'll be there.
But I'm thinking about it.
Yeah.
I'll be there.
I don't know. Like I get to hang out with you here. Maybe not scratching the itch of in-person stuff. I also haven't met Amy yet.
Oh my gosh, yeah, that would be good.
Yeah.
A good time to meet Amy.
Anyway, just want y'all to know.
Thank you so much.
People are still messaging me, so I hope the
Awesome.
coordinators don't hate me because they'll get another. Just gonna let the day end. And then send whoever messages me last minute.
We're having a meeting this afternoon, so yeah, I can report back to everybody what you're telling me and we'll be prepared.
And in person.
Y'all,
good.
Andy, did you?
Thanks so much.
You know about the Youth IDD Mental Health Summit?
Oh, there's flyers. Yeah.
Do you wanna go?
Community.
Not where cranberries belong. They belong on the trail mix, not in my cookies.
Where gotta go? Virtual or in person, whatever.
Yeah.
For all your participation.
The first time I heard that song, I thought it was Hero.
I think they also record them too, so if you like register.
Oh.
Because I heard it in karaoke and whether they were singing it.
Was it
Sounds like,
cursive?
sounds like how Shakira like fluctuates or.
Is Elliot already gone?
Yeah, they're like an hour from now, they're facilitating somewhere in Wyoming.
Go down I-5.
They like squeeze with
Yeah, they're busy.
Hey, man, you go same speed on
I haven't fallen in
99, man.
favor
I'll
for
tell you,
the
I ain't go a little fast.
Right, you can actually.
I just go to the Paco yesterday.
There's so much to see.
They check the app to make sure. that they
I just love me a spud.
Well,
I like me a taters.
Very, very excited.
How's it good English talking?
Nice.
For what?
Well, the
Tuna. The tuna.
let's see.
You must.
Said-
It's a really funny thing, like.
Oh, geez.